Namaste. Welcome you all for the yoga session. In this session, we are going to do one of the standing postures, the Veerabhadrasana 2, in conjunction with some specific posture that would enhance the quality and effectiveness of the standing postures. Before that, we shall do some basic postures for the core muscles. Lie on your back, fold both the legs, heel closer to the hips, foot 6 inches apart, foot parallel to one another. Feel your breathing. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Feel also the posterior region at the lower back that also responds to the breathing. Watch your breathing. Chest should be reasonably stable, neutral. Watch the movement of the diaphragm. As we inhale, allow the abdominal cavity to expand throughout, all around, circumferential expansion of the abdominal and the pelvic cavity. As you exhale, it should contract. Towards the end of exhalation, try to contract the abdominal muscles little more than normal. This is a very fundamental breathing which has to be implemented throughout in all the postures. This breathing not only helps the abdominal muscles but also helps the mind to calm. Stretch both arms up. Breathe consciously. Neck at the center, chin towards the chest. Rise your right leg up. Straight the heel. Pull the kneecap. Toes towards the knee. Pull the kneecap. Tighten the quadriceps, the front of the thigh. Feel the stretch at the back of the thigh. Watch your hip. Watch the gluteal muscles or the muscles of the hip. Watch your back muscles. Press the left foot. For that you got to activate the calf muscle. Also contract the hamstring muscles against the calf muscle and feel the knee capsule. That is the outer covering of the knee on your left leg. Fold right leg down. Left leg up. Pull the kneecap. Stretch the heel. Consciously watch the muscles of the leg, especially the calf muscle, hamstring, then the muscles of the hip and also the lower back. Do not miss out on your breathing. Breathe at ease. Down. Right leg up. When raising the legs, also ensure that the base of the spine does not take off the floor. Pull the kneecap. Stretch the heel. The muscles of the leg, especially the hamstring, they help the back a great deal. Right leg down, chain, left leg. Pull the kneecap, stretch the heel, The hamstring muscles are connected to the hip bone, and on the hip bone sits the spinal column. So they are all involved in a kinetic or kinematic chain. The health of the hamstring is very crucial. So see the stretch. Relax the left leg. Right leg up. Fold. Hold the right knee from both hands and pull the knee closer to the chest. And keep the foot, knee and the hip in the same plane. That is, do not move the knee out of the plane. And on both the legs, squeeze the hamstring muscles against the calf muscle and feel the inner corners of the knee. Also feel the outer covering of the knee capsule. Watch your breathing. Release right leg. Left leg up. Fold. Hold the knee. Press the knee closer to the chest. This particular posture does help the gluteal minimus and the gluteal medius muscles. These are the two muscles in the region of the hip that greatly helps in all our walking. Pay attention to the breathing. That is the key. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Release left leg. Right leg up. Fold, hold the knee, press the knee closer to the chest. Stretch the heel, right heel, that is toes towards the knee. Do not neglect the left leg. You should press the left foot. For that you have to activate the calf muscle, then contract the back of the left thigh. Watch also the posterior skin, the thick skin resting on the floor. Release right leg. Chain. Left leg up. Fold. Hold the knee. Press the knee closer to the chest. The posterior thick skin on your lower back, the thoracolumbar fascia as it is called, that also responds to breathing. Just watch that. It also experiences a mild stretch as you inhale and a contraction as you exhale. Get connected with the posture, get connected with the breathing, be present. Release left leg. Right leg up. Fold the knee from left hand, hold the ankle joint, pull it closer to the root of the left thigh. From right hand, push the knee. On both the legs, contract the hamstring muscles, the back of the thigh against the calf muscle to enhance the feeling of the knee capsule. As we inhale, sensitize the base of the spine. Feel the base of the spine, especially the sacroiliac joint. That is the articulation between the iliac bone and the sacrum of the spine. Release the right leg. Change. Left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh. From left hand, push the knee. It's very important to have complete postural awareness. Do not allow the pelvis to rotate. Release the left leg. One more time. Right leg up. Fold from left hand, hold the ankle joint, pull the heel closer to the root of the thigh. From right hand, push the knee. Activate the back of the thigh on both the legs. Breathe consciously. Feel the base of the spine. All these postures are designed to help the core muscles, which would include the region of the abdomen, the lower back, the hip, the pelvis, because this is the region which takes a lot of loading, and these postures prepare one to safely practice other postures. Release right leg. Change. Left leg. Fold from right hand, hold the ankle joint, pull the heel closer to the root of the thigh. From left hand, push the knee. This posture also obviously helps the knee joint, the hip socket also gets a good soothing movement. The sacroiliac joint experiences a mild but very necessary movement. Good breathing is the foundation for all these postures. Release left leg. Right leg up. Fold from left hand, hold the ankle joint, pull it from right hand, push the knee across the chest. This is a very good stretch for the gluteal maximus muscle, which is one of the major muscles located in the region of the hip. Again, watch your breathing. As you inhale, the abdominal cavity should expand, as you exhale, it should contract. Release right leg. Left leg up. Fold from right hand, hold the ankle joint. Pull from left hand, push the knee across the chest. Press it closer to the trunk. Now here the abdominal muscles and organs also stand to benefit because of enhanced massaging movement under the pressure of the thigh. Do not neglect the right leg. Press the right foot. Tighten the calf muscle. Tighten the back of the thigh. Release left leg. One more time. Right leg up. Fold from left hand, hold the ankle joint. Pull from right hand, push the knee across the chest. Feel also the lower back. No muscle acts in isolation. They're all connected in a great kinematic linkage. So that is why all these varied movements are essential to keep this whole chain of movements healthy. Release right leg, chain, left leg up, fold, from right hand hold the ankle joint, pull, from left hand push the knee across the chest. You must do these postures with awareness. Mechanical movements does not yield great results. The movement should be done with awareness. You must be present. You must get completely involved. Release left leg. Watch your breathing. Right leg up, fold, hold the knee, press the knee closer to the chest. Stretch the right heel. Now lift the left foot, keeping the heel on the ground, then slowly sliding the heel, straighten the left leg. Pull the kneecap. Push the knee as close to the ground as possible, while you draw the right knee as close to the chest as possible. So right hip is going towards a strong flexion, while the left hip is going to a neutral position. In effect, this is a very good movement for the back muscles. Slowly fold your left leg, taking the heel closer to the hip. Release right leg. Chain, left leg up, fold, hold the knee, press the knee closer to the chest. But completely pull the knee. Keep the left heel active, toes toward the knee. Then slowly slide the right foot. Keep the heel in contact and gently slide, straightening the right leg. Right heel also have to straighten, toes towards the knee. Pull the kneecap. Charge the thigh as close to the ground as possible. Feel the region of the tailbone. Breathe well. All these movements are very useful, especially in the beginning. Slowly fold your right leg, release left leg. Right leg up, fold, hold the knee, press the knee towards the chest. It's also important to repeat these postures. Then slowly slide your left leg forward, straightening the left leg. When you do that, ensure that you maintain the line and length of the left leg. That is, you should not deviate the axis of the left leg. Watch your breathing. Feel the hips, feel the thigh, feel the lower back. Slowly fold left leg, taking the heel closer to the hip, then release right leg. Chain, left leg up, fold, hold the knee, press the knee closer to the chest, stretch the heel, gently slide the right foot, keep the heel in contact with the ground, raise the foot, then stretch right leg. Pull the kneecap. Feel the pelvic cavity also as we inhale and exhale. So these movements prepare the core muscles for further action so that they become very safe to practice. Slowly flex the right leg, then release left leg. Just be attentive. Right leg up, fold, rest the right ankle just below the left knee, rise the left leg from both the hands, clasp the left thigh, pull closer to the chest. Also move the right knee slightly away from the trunk. Feel the region of the hip. You must feel the deeper muscles in the hip. Keep both the heels active. Slowly bring the left foot down. Take the right leg down. Chain, left leg up, fold. Keep the ankle slightly below the knee. Rise the right leg, clasp the thigh from both hands and pull closer to the trunk. Both the heels active, toes towards the knee, which means the calf muscle gets a good stretch. Do not lose track of the breath. Release right leg, release right leg, left leg also down. One more time. Right leg up, fold, ankle joint just below the left knee, stretch the heel, rise the left thigh. Now from left hand hold the left thigh, pull from right hand to push the right knee. Now you can feel enhanced stretch deep in your right hip. You are stretching one of the important muscles, the piriformis muscle, the deeper muscle in the hip, which happens to be very close to the sciatic nerve. Release the legs, right leg also down. Chain, left leg up, fold, ankle just below the knee, rise your right leg with knee flexed. From right hand, pull the right thigh, from left hand push the left knee. Keep the heels active. So all these postures rejuvenate the muscles in and around the lower back, hip, pelvis. The hip joint also gets a very rejuvenating movement. Knee and ankle also become active. Release the right leg, left leg also down. These set of movements help one to prepare in a safe way for doing other postures. Rise both legs up, hold the knee, press the knee gently towards the chest. Breathe well. Even here, stretch the heel and tighten the hamstrings against the calf muscle. You must make the posture as effective as possible. Also watch your breathing. Watch the posterior region, that is the thick skin resting on the mat, especially the lower back and the lower part of the upper back. That's where the thick skin, the thoracolumbar fascia is spread. Just watch. And tightening the hamstrings helps the knee capsule a great deal. Stretching the heel helps your ankle joint, the arch of the foot, the intricate muscles, ligaments and joints in the foot also. Do not let the muscles of the forearm and upper arm, that also you should actively engage. And of course, you've got to breathe consciously. So when you do all this, your mind cannot oscillate. It will be in the posture. That is when the posture becomes a yoga asana. Release the legs. Feel the breathing. Stretch your left leg forward. Roll onto the right side. Press the left palm. Slowly get up. So these are some of the basic postures that greatly helps one to relax the most taxed portion of our system. Sit on a folded blanket. Sit on your heels, sit upright. Watch your breathing. As you inhale, the abdominal cavity expands, and as you exhale, it contracts. Kneel down. Take your right leg forward, right knee bent at 90 degrees. Both hands on the waistline. As you exhale, flex the knee to the best possible extent. Press the right foot firmly. Tighten the right hamstring muscles. Left foot stretched backward. Tighten the left calf muscle. We'll open the chest. Orient the trunk in the direction of the right foot. Do not push the right knee out of the plane. Feel the stretch in the pelvis and abdomen. posture for the hip flexors. Press the right foot, slowly come up, take the right leg back, chain. Left leg forward, knee bent at 90 degrees, thigh parallel to the floor, both hands on the waistline. Inhale, exhale, flex the left knee. We'll open the chest. You can see that the left hip is in flexion, right hip is in extension. Also left knee is in flexion, left foot is in dorsiflexion, whereas right foot is in plantar flexion. So it's good for the lumbar, pelvis and the hip region. It's also good for the muscles of the legs. So these are very important in any of the standing postures. Press the left foot, slowly come up, take the left leg back, sit on your heel, sit upright. Kneel down, right leg forward, right knee bent at 90 degrees, right thigh parallel to the ground, both hands on the waistline, rise up, straighten the left leg, press the outer edge of the left foot against the mat, chest and navel up. Do not allow the pelvis to turn. Keep the right leg bent at 90 degrees. Turn the neck towards the right. Tighten the right back of the thigh and the right calf muscle. Do not allow the pelvis to turn, and the trunk should not sway sideways. Chest and navel up. Slowly flex the left knee, come down, take the right leg back. Change side. Left leg forward, both hands on the waistline. Straightening the right leg, press the outer edge of the right foot. Trunk and the legs must be in the same plane, perpendicular to the floor. Chest and navel up. Look to your left side. Turn the neck and look to the left side. Tighten the left hamstrings and the left calf muscle. Press the left foot firmly. Left foot should center the right foot. Watch your hips. Watch the complete trunk. Elbows closer. Flex the right knee, take left leg back, sit on your heels. Take both hands forward, keep the fingertips on the floor. Take your right leg forwards, press the right heel, stretch the toes back, slightly bend the right knee, slightly bent, press the right heel down and pull it towards you without moving the heel. Chest and navel up. Feel the hamstrings. Then slowly straighten the right leg. Push the root of the right thigh down and stretch the chest and navel up. This is a good stretch for the hamstring muscles, the back of the thigh. Back of the thigh plays a vital role in all the standing postures. One of the heavy muscles that we have. Slowly take the right leg back, left leg forward. Press the left heel, left knee slightly flexed. Stretch the toes. Push the left heel down and pull it towards you and feel the back of the thigh. It gets greatly activated. Breathe well. Then slowly extend the left knee, chest and navel up. It's a good stretch for the hamstring, also for the gluteal region. The back of the thigh has an important role in the health of the lower back also. And maintain the correct orientation for the leg behind. Now take your left leg back, sit on your heel. We are going to now do Veerabhadrasana 2 again. Remember the stretch in the hamstrings. Kneel down, take your right leg forward, press the right foot, tighten the right hamstrings and the right calf muscle. Both hands on the waistline, tighten the left leg, press the outer edge of the left foot, right foot to center the left foot. Orient the trunk properly. You have to turn the trunk so that the legs and trunk are in the same plane perpendicular to the floor. Look to your right side, chest and navel up. Feel the hamstring muscles on both the legs. Roll the left thigh, press the outer edge of the left foot. Feel the arch of the left foot. Feel the right ankle, right calf muscle, right thigh. Do not hold the breath. Breathe well. Flex the left knee. Take your right leg back. Chain. Left leg forward. Bent at 90 degrees. Left thigh parallel to the floor. Press the left foot. Straighten the right leg. Press the outer edge of the right foot. Hold the trunk in balance. Trunk should not move sideways. Keep the trunk upright. Turn to your left side. Look at your left side from the neck. Hold the trunk and legs in the same plane. Be strong on both the legs. Veerabhadrasana 2. Very good for the legs. Also helps the pelvis and the hips. Flex the right knee, take your left leg back, sit on your heel. Lay on your chest. Stretch the toes back. Tighten the calf muscle. Rest the forehead on the mat. Keep the palm by the side of the forehead. Middle finger pointing forward. We are now going to work with the backward bend. So this completes trunk musculature and also the arms. They get energized. Press the palm by the side of the forehead. Inhale, exhale, rise. Straighten the arms, rise the trunk up, open the shoulders, stretch the neck up and look up. Tighten the calf muscle. A good extension for the complete spinal column. Feel the pelvis, abdomen, chest. They all experience a good stretch. Arms also stand to benefit. Slowly flex the arms, come down. Now keep both the palm just below the shoulder joints, middle finger pointing forward, spread the fingers, press the palm. By changing the position of the palm, the extension of the spinal column can be improvised. Press the palm, inhale, exhale, raise the trunk, well open the shoulders, thrust the chest upwards and forward, lift the neck up the clavicle and look up. Hyperextension of the complete spinal column, including the cervical spine. Feel the region of the throat, the thyroid and parathyroid glands. Feel the complete chest. Feel the abdomen. Feel the pelvis. All the muscles and organs there, they get a good stretch. Tighten the buttocks. Stretch the toes back. Squeeze the calf muscle. Tighten the muscles of the upper arms and forearms. Flex the elbows, slowly come down. The backward bend helps one to feel the muscles and organs of the trunk better in the standing posture. Now keep both the palm by the side of the chest, rib cage. Middle finger pointing forward. Elbows closer to the trunk. Press the palm, inhale, exhale, rise the trunk, well open the shoulders, lift the neck up and look up. Stretch well. So develop a feel for the chest. Lifting the chest up is very important. Here the scapulae should move closer to the spine and slightly downward. That is when chest can be elevated properly. So same thing has to be implemented in the standing posture. So the intermediate postures being done to improve the standing posture. Slowly flex the elbow, come down. Press the palm, slowly get up, sit on your heel, sit upright, stand upright in Tadasana, join the heel, join the big toe, pull both the kneecaps, roll the thighs in, push the tailbone in, squeeze the buttocks, chest and navel up, stretch both arms down, flex the arms, keep the palm on the waistline, inhale, exhale, jump forward to 4.5 feet apart. Right foot 90 degrees out, left foot in. Ensure that the pelvis does not turn. Press the outer edge of the left foot, keeping the left leg straight, inhale, exhale, flex the right knee at 90 degrees. Chest and navel up. Trunk should not sway to the side. Turn the neck and look to your right side. Feel the even pressure on the ankle joint. Tighten the right calf muscle and right back of the thigh. Chest up. The scapula should move closer and slightly down so the chest is properly elevated. Remember the feel of Bhujangasana, the backward bend which you did just now. Both hands on the waistline. Straighten the right leg. Inhale, come up. Change. Right foot in, left foot 90 degrees out. Left foot in line with the right center of the foot. Press the outer edge of the right foot. Keeping the right leg straight, inhale, exhale. Flex the left leg at 90 degrees. Making the left thigh parallel to the ground. Veerabhadrasana 2. Hold the pelvis in balance. Turn the neck, look at your left side. Roll the right thigh. Increase the arch of the right foot. Feel your abdomen, pelvis and the chest. Recall the backward bend. That experience you must use here to feel the muscles and organs of the trunk better and deeper. Slowly come up, foot parallel, inhale, exhale, jump, Tadasana. Fold the blanket, make it a little thicker. Sit in cross-legged posture on the blanket, hips on the blanket, foot on the mat. Sit upright. We're going to do a twisting posture which further helps to orient the trunk better in the standing posture. Inhale, exhale, turn to your right side, left wrist on right knee, right hand fingertips on the floor. Grip and turn the trunk. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Take the right hand fingertips as far back as possible. Turn the neck also in the direction of the twist. Breathe consciously. Upon twisting, be present, get involved in the posture. Slowly come up, change, turn to the left side, left hand, right hand on left knee, left hand fingertips on the floor. Inhale, exhale, turn. Well, open the left shoulders. Twisting creates more freedom at the lower back and the abdominal regions, which would help in orienting the trunk in all the standing postures. Slowly come up. Stand in Tadasana, join the heel, join the big toe, pull both the kneecaps. Both hand on the waistline. Inhale, exhale, jump 4 to 4.5 foot apart. Right foot 90 degrees out, left foot inside. Press the outer edge of the left foot. Do not allow the pelvis to turn. When you turn the right leg 90 degrees, it will have a tendency to turn. You should prevent. Keeping the left leg straight, inhale, exhale, sit square. Bend your right leg at 90 degrees. Look at your right palm. Keep the shoulders even. Chest and navel up. Breathe consciously. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Be strong on your left leg. Increase the arch of the left foot. Slowly come up. Then chain. Right foot in, left foot 90 degrees out. Hold the pelvis in balance. Keeping the right leg straight, inhale, exhale, sit square. Look at your left side. Activate the left calf muscle and hamstring, that is back of the thigh. Be strong on your right leg. Feel the trunk, feel the hip, feel the pelvis. Use your breathing. Be present. Feel the posture, feel the breath. Slowly come up, foot parallel, jump, third asana. Sit upright on the blanket, chest and navel up. Clasp the fingers. Grip. Inhale, exhale, rise both arms up, open the face of the palm upwards, both arms straight. Lift them up and push them slightly back so that you feel an enhanced stretch in the complete shoulder complex. Lift yourself up from the arms. Tighten the muscles of the forearm and upper arm. Feel the extension in the wrist. Straightening the arms is another important aspect in the standing postures. So remember the stretch in the arms. And we are going to complete Veerabhadrasana 2 with this stretch. Slowly flex the arms, come down. Stand in third asana, join the heel, join the big toe, stretch both arms down, squeeze the buttocks. Inhale, exhale, jump 4 to 4.5 foot apart. Stretch both arms sideways, both arms in line, stretch well. Right foot 90 degrees out, left foot inside. When you stretch the arms, the scapulae should not move away. They should move closer and then down. Inhale, exhale, keeping the left leg straight. Bend your right leg at 90 degrees. Stretch the arms, look at your right palm. Ensure that the pelvis do not turn. Do not push the hips back. You must push them forward. Hold the trunk and the legs and the arms in the same plane, perpendicular to the floor. Tighten the right calf, right hamstring, press the outer edge of the left foot, stretching both arms, inhale, come up. Chain, right foot in, left foot 90 degrees out. Keeping the right leg absolutely straight. Inhale, exhale, bend your left knee at 90 degrees and look at your left palm. You have to turn the neck and look. Feel the legs, feel the hips, trunk, arms, neck. Develop complete presence of mind. you should do mindfully. Also watch your breathing. Slowly come up, foot parallel, inhale, exhale, jump, feet together, third asana. Sit on the blanket in cross-legged position, chest and navel up, palm should face upwards, tip of the thumb and index finger in contact. So in this session, we have done Veerabhadrasana 2 along with some of the postures which enhances the depth of the posture. Namaste.